Right. So we know a lot of you have so many questions about the Delta variant and the new guidance from the CDC too. So let's go ahead and bring in Dr. Allison Bartlett from the University of Chicago Medicine. She specializes in the medical management of acute and chronic infectious diseases. So Dr. Bartlett, welcome. Thank you for being with us this afternoon.
Thanks for having me.
All right, so the CDC says the Delta variant of COVID-19 is as contagious as chickenpox. First of all, what does that mean? And do we know what makes it spread so easily?
So it's kind of an apples to oranges comparison because COVID and chickenpox are not transmitted in exactly the same way, just like it's not transmitted the same way as Ebola. But what they're referencing is that any one person with a chickenpox infection can easily spread it to another 8 people. So any one person with a COVID Delta variant infection looks like they can spread it to 5 to 8 people. And the reasons for that are couple-fold. And again, this, like with all COVID information, is evolving. But the amount of virus that's present in the respiratory secretions of someone who has a Delta variant is much higher than the other original variant. And the virus remains in their respiratory tract longer. So you are more likely to spread for a longer period of time.
There have been a lot of new mask recommendations, doctor, over the past 2 days. Many people pushing back on this or confused. Can you add some insight on why the vaccinated people should wear masks?
So there are 2 different kinds of science at play. There's the science of the vaccine and how amazingly effective it is at preventing severe illness and death, which is great to protect the individual who's vaccinated, assuming they have a normal immune system. But there's also public health, which now we know even people who are vaccinated can have an infection. They don't get sick, but they can transmit it to other people. So public health says we should all wear masks to protect those around us.
And doctor, what should people who are vaccinated to go against COVID-19 know about the Delta variant? How concerned should they be about a breakthrough infection, getting sick themselves, or making other people, especially if you have relatives who maybe have a compromised immune system? There are concerns there.
There absolutely are. Even if you are vaccinated, again, you are very unlikely to become severely ill or need hospitalization, but you could spread it to someone who is unvaccinated or whose immune system is not normal because they have some immunodeficiency. I'm the mother of 3 kids under 12 who are unvaccinated, not by choice, but because the vaccine's not been approved for them yet. And so it really is masking to protect those around you.
And let's talk about kids for a moment. You're a pediatrician. Are there any special concerns with the Delta variant? And kids, are they getting sicker or dying?
So we don't know enough about infections in children with the Delta variant to know if it's going to be more severe or not. There looks like some evidence in adults that it might cause more severe infections. But we are definitely seeing more infections overall in children as the rates go up. And as we've learned from previous spikes, we will and are starting to see an uptick in the cases of MIS-C, which is the multisystem inflammatory syndrome that we see in kids after they've had a COVID infection. Again, still very, very rare, but will be on the rise as we see more cases of COVID.
All right, and Dr. Bartlett, obviously, we thought we were getting to summer and being able to enjoy each other's company once again. So a lot of people thinking, how are we going to deal with this COVID fatigue right now? What is your recommendation?
I wish I had some easy fix or some, new magic tool. But unfortunately, if not everyone is taking it as seriously and, doing all of the mitigation steps, I don't know how we get out of this limbo. I feel like we're stuck with everybody wearing masks until everybody's vaccinated. And then that will mean that we have fewer variants that can pop up and cause problems. So really the most important thing that we can do is get everyone vaccinated. Until then, it's masks for everybody.
Dr. Allison Bartlett from University of Chicago Medicine, thank you for joining us and answering some questions for us today.
Hey, if you like that video, be sure to subscribe to our ABC7 Chicago YouTube channel.